Hey guys, Mike here. This is the first video in a series that I'm going to be making that'll document my experiences having orthodontic surgery, which is also known as jaw surgery, and it'll correct an underbite and a crossbite that I've had most of my life. Now, most of you know what an underbite is, but if you don't, here's what it looks like. There's a gap in between the front and lower teeth where the front teeth are behind the lower teeth. And additionally, a crossbite, in my case, is the gap in the front teeth is a bit off center. If you were to draw an imaginary line down the front of my face, the gap in between the two front teeth is off center of that median plane. And you can even see it when I'm talking a little bit. The way that my lips move is a bit asymmetrical. So this procedure will help correct that. In my case, they're only going to be doing an upper jaw surgery, so they're going to break the top part of my jaw and move it forward to correct for the underbite and the crossbite. However, some people, depending on their anatomy and their way that their particular case, they may have to have both lower and upper jaw moved simultaneously. So I'm lucked out in the sense that I only have to have one jaw, which makes the procedure much less complicated and the recovery quite a bit faster from what I'm told. But this whole video series is going to be about my experiences. There's a lot of literature online where you can talk with oral surgeons about your particular case. I'm assuming that if you're watching this video, you're thinking of having oral surgery or jaw surgery to fix your bite, whether it's an underbite, overbite, or a open bite. But there's plenty of literature on how the procedure is done, but personally I've gotten a lot out of watching other people who have created videos and where they really show their what their experience was like. And I thought, while there's a lot of videos out there like that, I would go ahead and create my own, because even if this gets lost in the database of YouTube somewhere and it only gets a few hundred hits, that's fine, because this is all about being supportive of other people, who are going to have this surgery, because it's not easy. I mean, it's an intimidating surgery, but I think that seeing, other people's experiences and knowing what they feel and what they go through is comforting, and to know that you're not the only person that's going to have it, and that many people have had it before you and many people after you will have it. At least that's comforting to me. So that's what the main focus of this is going to be. And I think that the next video I'm going to make is going to be a couple days before my surgery, which is about a week away. I'm going to have it next Thursday, so it's about a week and a half away. And if you have any questions about any of the process, before, leading up to the next video before my surgery, go ahead and ask. I'll do my best to answer. Then once I have the procedure done, I'll start making videos as soon as I feel like I can be coherent enough to do it, because you are on quite a bit of pain meds once you're immediately after your surgery. So but really what I want to be able to convey is here's what it was like directly after, the first 3 days, especially. That I think that the swelling peaks about day 3. So it'll just give it's another data point where you can say, I've seen a lot of other people talk about their experiences, and this is on average this is what I can expect. So again, thank you for watching. If you have any questions or comments, please leave them. If there's anything I didn't cover, I'm doing this kind of improv right now, and I'll go ahead and answer any questions I can. Until then, look for my video in about a week or 2, a week and a half, and take care.